when it comes to the health space, we also have that feeling of what is the digital health public infrastructure. So when you talk about the digital public health infrastructure, there are three most important gateways into the ABDM system. So one of them is the UHI, as I talked about.
Morning everyone. Welcome to 11th episode of Arogyam Katta. Today, instead of health issues, we'll be talking little on the different but related to health. We are going to talk about Ayushman Bharat Digital Mission, and we all of us use UPI, that is Unified Payment Interface. Or majority of us make payments almost every day through Google Pay, or Paytm or many other medias. So similarly, Government of India has introduced UHI, Unified Health Interface, and we have to explain about UHI. We have expert of that, Dr. Mukesh Gupta, who is a gynecologist, and he is a wonderful man, a wonderful doctor, and he'll be explaining us the integrities of the UHI, what is it, and how do we register, or how does doctor register, so on and so forth. So welcome Dr. Mukesh Gupta to the Arogyam Katta.
Thank you. Thank you for inviting me.
Doctor, what is this about? I mean, can you explain? It's so confusing that ADPH, AUHI, these abbreviations really confuse us.
Okay, so I'll tell you a little background how I got hooked up to it. So I was I'm primarily a gynecologist, as you know, and I'm very happy in my practice. But my curiosity of how and in which direction the country is moving when it comes to healthcare space and digital space. So I've also done my strategy mind from IIM Calcutta. So that mindset pushed me into thinking that what is happening next and what can be done in the long run. So if you look at the country's development, there are two infrastructures that we are parallelly working on. One is the infrastructure when it comes to the geographical space, the roads, the transport, the ports, the airports, etc. So my interest and my curiosity of understanding in which direction the healthcare is going in the digital space comes from the fact that I'm not only a gynecologist and a very happy practicing gynecologist from Lenest Malad, Mumbai, but besides that, I did my strategy man from IIM Calcutta. So what I saw is that unless you have a long-term strategy, you cannot expect any development and growth and betterment of an organization or the system. So when I was looking at what is happening in the digital space, I thought that, see, for a country to grow, there are two aspects. One aspect is the infrastructure, which is geographical infrastructure. So the roads, the services, when it comes to healthcare, the type of hospitals, the type of structures, the type of equipments and gadgets, training of the doctors, that's one infrastructure. The second infrastructure is the interoperability and connectivity, which the digital world has changed drastically. So now when we look at the overall digital space infrastructure development in India, we have done huge advantageous growth. One in the space of, as you rightly pointed out, the financial sector, like the UHI, primarily identification of citizens, like in the form of Aadhaar card. Our passport system is also getting much more advanced and developed than it was earlier. The DigiLocker is an unbelievable repository for all our regulatory requirements. Even when you travel, we are using DigiYatra.
Even insurance is under DigiLocker.
Yeah, so DigiLocker is a place where the government, all the certificates and licenses, whether it is your 10th standard passing certificate from your board to 12th standard to your degree, everything you can actually store. I think maybe graduation and post-graduation degrees may not be there, but 10th and 12th is still there. And then there are so many, all those things that you're registering are there. Even your driving license, etc. So from that perspective, what is happening in health space? So in health space, we have a proven track record, especially at the time of COVID, when we had that amazing COVID app. So that COVID app was a game changer. Now, similarly, we are now moving towards the digital health mission, the Ayushman Bharat Digital Health Mission, which is what is happening, ABDM. Now, when you say the Ayushman Bharat Digital Mission, it is actually coming from our national health policy. I think 2017 it was laid down, and this was the direction was lined up. And we are moving towards a huge interface which is being created by the government as a facilitator for all the players. So if this is an interesting slide here, which I always say that, when we talk about the stakeholders, so whether it is the government, the hospitals, the labs, the insurance, the healthcare professionals, the non-profit organizations, or actually the patients themselves.
So everything is
they are
together under.
Yeah, they are going to be able to reach out to this under one digital, interoperable, and accessible system. Now that is a very extremely brilliant mission, which I feel is we are moving towards. Now, if we understand the benefits, the best part about it is that we are going to actually reach out to an era where, so once a patient walks into our clinic, our biggest challenge is we write down the whole history. Then he goes to another doctor. He again goes through the whole process. Then the patient says, okay, I got these tests done from this place, and then transfer is not happening. All those things, at one end, the doctor patient transactions. At the other end, those transactions where the insurance wants the detail of the patient and the discharge summary and all those things will also be uploaded in the system. So as we go ahead, I'll tell you more about the whole infrastructure.
So it's for both the doctors, the pharmacists, the hospitals, the medical laboratories. Everyone is
the vision is you have a interface where the users, whoever are the users, whether the doctors, the patients, the insurance, the various different labs and etc., or the regulatory authorities on the other end, all that information can be accessed through this.
Together.
So that is one interface. So the best part about the interface is going to be that the data will be stored at the actual place of generation or wherever the doctor or the patient wants to store it, and is not stored by the government. The government is only giving a connectivity. Like, for example, we have a bank account and we have all of our money in our account, and then you want to pay me. So we are using one of those UHI interfaces. From your bank, the money comes to my bank, and you're just routing it through the interface. So the money is not in the interface.
Okay.
It is not parked there. Money is parked in your account, and from their account you're only transferring the transaction ID.
Okay.
Of your interaction, which comes to my bank, and then your bank will transfer to my bank. So the platform is only ensuring.
So it doesn't do any data storing per se. So
no.
Okay.
No. So that is stored at our own secured locations where we want.
Okay. Now, anyway, we'll discuss that later. But as a patient, how do I register for this? How do I take advantage, or what is in it for me as a patient? Where do I register?
So as a patient,
where do I go to register?
The best part about the whole system is if you understand the ecosystem and the architecture of the system. So let me show you one interesting.
This is National Health Authority.
So this is ABDM architecture.
ABDM architecture.
And if we look at the the architecture, the whole system works. Let me go to the website only. I think that is the best place to get all the information. So when we look at the ABDM registry, what normally happens is there are three. Okay, let me explain this first because later on you can put the slide. So there are three major registries which are going to be maintained by the ABDM. So one registry will be ABHA. Okay. So when we talk about ABHA, let me show you the ABHA registry. So this is an ABHA number. An ABHA number is a number which you basically are creating for yourself. And this, when you log in for the ABHA number, you go to the site of ABDM and you register yourself as an individual. So as a patient, I have to. As a patient, so Mukesh Gupta as a patient will have an ABHA card.
Okay.
So as a patient, when I go to say another doctor, so I will need my health records in one place. So that number is linked, unique number of mine, like an Aadhaar number.
Like Aadhaar card.
Yeah, or a PAN card number, unique number. So my ABHA number is unique, and all my data, whether it is my prescriptions, discharge summaries, my health records, my lab reports, my X-rays, my
medical,
everything can be stored, which is linked to my ABHA card. So when I use this ABHA number and I go to a second doctor for a second opinion, or if I am traveling from one city to another and I go to another city and I'm going there and I am not carrying my file, but my all data is there, so it can be retrieved at a click of a button. All access will be there. Or if I want to go through my details, I can also go through the details.
But then what about the privacy? Now suppose you can, anyone can access my record? That means?
Okay. So the whole ecosystem, whenever such a thing happens, there are two most important pillars which will ensure that people will accept it. And what are those pillars? One is consent. Without my permission, nobody will be allowed to share. So without your consent or your OTP or your permission, your bank account will never transfer the money to my bank.
Correct.
So similarly, your health record data will never be given to me unless you agree to give it to me.
Okay.
So you will have to give that permission. That's consent. Second is confidentiality. So you can choose what to be given and what not to be given.
Oh, I see. I will have options of.
So you can choose that, okay, these are the things that I want to share. You can share those things depending on what user interface you're using.
Okay.
Now this is an interface. So you have a choice to choose different user interfaces. Now this is where the whole opportunity for healthtech comes in. See, there are multiple user interfaces that can be created on this side. Okay? And on the other side, there will be multiple healthcare registries provider network. So HMIS system is on this side, and the user interface for the patient is on this side. So the patient, depending on what your user interface permits or not, according to that, that will be accessed.
That data only can be accessed.
Okay, so what we are giving is a connective open source UPI connected platforms, API connected platforms, which will permit data transfer easily and smoothly from one end to another. So Aadhaar card, to make anyone, but if anyone wants to make an Aadhaar card, it's very simple. Go to the NHA authority.
Okay.
Once you go to the,
we will give the link in the description for this.
So once you go to the NHA authority, you can just click for Aadhaar, or you can just Google the word Aadhaar. How do I register for Aadhaar? And they'll take you to the National Health Authority website and ABDM website, and there you can log in. And you can. There are two ways to do that. You can either choose to register with your PAN card or even your driving license for that matter.
Okay.
So even your driving license and your mobile number, if it is connected to that, everything will work.
So it's simple.
It's very simple.
It's not. Is it?
And the best place is to also store it in your DigiLocker.
Okay, there Aadhaar
card. So your DigiLocker, which has your PAN card, Aadhaar card, driving license, 10th standard, 12th standard certificates, all those things will also have your Aadhaar card.
So tell me, is it in a physical card form like Aadhaar, or is it a notional number?
Yeah, it's more like a notional number. It's like now what Aadhaar number is. So Aadhaar card is not of value. It is the Aadhaar number.
So that's what I'm asking.
It's the same thing.
The number is important. So even if I traveling, I don't need to carry the physical card.
No, it's a number.
I can either number or my DigiLocker will.
Yeah, because the access to your Aadhaar card is stored there in the DigiLocker also.
Yeah, I think then that okay now. Like my doctor, I go to a particular doctor consultant. How do I know that he also has registered for it or not?
Okay, brilliant question. In this era, imagine where digitalization has happened and you want to consult a doctor online. Or there is an app which says that, okay, you give me a prescription, you'll get it evaluated in second opinion or whatever. How will you know the person sitting on the other side is a doctor and not a quack? When you meet a physical person, and we are not yet able to solve that problem, where there are so many quacks who are still actually doing all the wrongs and it is causing a big impact on healthcare system. How will you take care? So in this EBDM system, there is a healthcare registry which is actually for the professionals. It's called as HPR, Healthcare Professionals Registry. So whenever you access, so if me, Dr. Mukesh Gupta, I want to register myself as a professional. So I have to go to the site and actually upload my documents and register myself. So all that, with a click of a button, you know that who are the registered professionals in your area, and you will be able to know the authenticity of them. That's the second thing. So if you look at the three different registries maintained, one is the ABHA, that is Ayushman Bharat Health Account, that is for an individual. Second is the HPR, that is Healthcare Professionals Registry for the doctors. And the third is the HFR, that is Health Facility Registry. So the patient, the doctor, and the hospital, clinic, lab, etc. is the third registry. So
when you say that me as a Dr. Mukesh Gupta register, so that is you as an individual, not the latest. Your hospital doesn't get registered there.
So Mukesh Gupta is registering in the Ayushman Bharat Health account as a patient. So if I may be a
No,
guy,
I'm talking, you are registering as a
so
doctor.
as a patient, I will register myself at ABHA. As a
Okay.
doctor,
You
that I am going
register.
to treat Mr. Gadgil. Well, I'm a gynac, so I'll treat your daughter or your wife, not you. So as a gynac, I'll be registering in the healthcare professional registry,
Okay.
and my hospital, LENS, or the professional name Neelam Nursing Home, will be registered in the health facility registry.
Okay.
So
you have
I will have
three
to,
registrations.
yes. So one is for my personal needs as a patient or my health, my own body. Second is for as a service provider as a doctor. Third is the infrastructure which I'm using as a hospital, which also has to be registered. So these are the three registries. And there's one more registry which is in the pipeline, and I'm not very sure how far we have reached there, and that is the drugs registry. Okay. The vision is that every drug that is approved to be used in India will be enlisted in that registry. And when we register there, imagine a patient is being prescribed some drug and they want to find it out, and they are hunting in here and there. Now, in an open source platform, anyone and everyone
can put any information. Even the company who manufactures.
Yeah, the company will say this is the best drug in the world, or let's not say the company, maybe some person, a person, or there may be someone who says that don't use this. Instead of that, you
ABC, use ABC instead of XY.
Yeah, so sometimes they may come up with some use aloe vera for delivering your baby. So I mean, there will be anyone who will be putting. So, but this is a government authorized regulated information which is provided by the drug company when they are taking their licenses and approvals, so that we have an authentic access to all the data. So that is going to be a big thing, and every drug will have a unique number. And that can be connected, and there is, imagine the potential. So even when I am prescribing a medication, I can actually link that number, the drug, so that I am also ensuring the patient knows precisely what I am giving and why I am giving and what precautions to be taken. So it will be much more easier for all of us. So I think we are moving towards a very good era, which is going to help us in a very big way.
Now tell me, now half the India doesn't understand English, or maybe I don't know the percentage, but many Indians don't understand English, especially you go to rural or even in urban areas also you have people not understanding English, or people want to transact in mother tongue. How do they tackle this? Or it's only restricted to people who know English?
India is a country with so many languages. Any national program that is happening and any national mission that is happening will never find success unless the local vernacular languages are taken into consideration and there is systems which are taken care. So I'm sure there is a lot of aspect, and with the advent of AI and the advent of various different learning modules and NLMs, etc. Now the transformation of data from one language to another language is getting easier and easier. So it all depends on what kind of. So now, for example, a registry, healthcare registry. So there is patient records. Now there are patient records can be as is, where is, and scanned and kept in, or it can be translated into utilizable data and kept in. Now that depends on the user interface that the patient is. Okay. So it is the patient's choice. If the patient has suppose got a prescription written in say Marathi or Hindi or something, and that whole data has been uploaded in the system in that language. So the same access can be done by the next doctor through that. But suppose if the user interface that the patient is using is actually having the ability to capture those important data aspects, and that which is very which are numerals or which are the lab reports or whatever, that actually can be used in that processed form also, depending on what user interface is. And that is the place and the scope for the future digital vision for India. So in fact, there is a document with our national health authorities have come up with. Our NHP contains this information where they have given a document about artificial intelligence in healthcare. Oh, okay. It is actually provided by the government of India. So in which direction we should be thinking? So I think it is high time that healthcare is not looked as only the doctor giving prescription and medicine to the patient, but the whole ecosystem, how we can all become better in health, more aware and more careful, and the help of technology and artificial intelligence here is going to be great. Recently, I was actually invited at one of the institutes at NMIMS where they have Mukesh Patel Institute of Technology, where they are having graduation courses in artificial intelligence. So these children, they were so vibrant and they were so enthusiastic. And then they wanted to know more on what can be done in healthcare space. We had a whole 2 hours workshop where we discussed about artificial intelligence in healthcare and what is the direction, what are the various approved AI tools by FDA. If you go to US FDA site and look for the approved artificial intelligence, you see huge number of tools which have been approved by US FDA. Similarly, I have interns coming. So my hospital is an internship station for BITS Pilani.
Okay.
BITS Pilani, all three campuses, whether it is Pilani original, Hyderabad as well as Goa, the children come and work for 2 months as intern. So we give them projects on various different aspects. So most of them who are not technologically so sharp are looking at healthcare space as a potential location for their entrepreneurship and their startups.
Oh.
So many of them come. In fact, two of my students have started their own startups and they have been doing well. So I realized this, that now we are not just looking on just doctor and patient as a prescription based relationship, but also about how we can use technology to identify the risk factors, try to create an intervention strategy, and then monitor whether it is working or not at an individual level, at a geographical level, and at a national level because of technology.
One question now, when we are talking doctor at your hospital, is it restricted to allopathic or even other pathies, which are naturopathy, which are so many other pathies which
so it's a government
India has?
So it's a government's decision to put on all healthcare professional registry, all those registered medical practitioners.
Right.
So if any pathy which has been registered and authorized for practice by the government.
So wherever there is a council.
Yeah, wherever there is a council.
There is a council, yes. Medical council, yes. For that pathy.
Yes.
So those are the legal practitioners.
Yes.
Or those are authorized practitioners.
Yes. It's high time that a lay person has an access and awareness that the person who's treating them is an authentic doctor.
Correct.
And not acquired.
Not acquired.
It's high time that we have that pattern. And I think this is moving in that direction.
Great. Doctor, I have one more last question. Many times we heard word DPI. I don't know what is the long form of DPI and what it means. But whenever government officials are talking, a lot of places DPI word comes in. So DPI, what is it?
So DPI is, as I started, so we're going back, like a stand-up comedy when they go back to the original conversation. So we are going back to our first question.
Okay.
DPI is digital public infrastructure.
Okay.
So the digital infrastructure which has been created for the public is something which will transform our overall well-being as a nation and towards our Viksit Bharat. So when it comes to the health space, we also have that feeling of what is the digital health public infrastructure. So when you talk about the digital public health infrastructure, there are three most important gateways into the ABDM system. So one of them is the UHI, as I talked about. That is the unified health interface, which is basically a transaction base where at one end there is hospital service providers, that is HSPA, and other end there is the end users, that is EUAs. They connect with each other, and then information from the patient and the hospital goes through by this unified health interface. The second is actually one of the most important component is the health claims exchange. You know why? Because more and more insurance companies and more payments are happening through insurance. So when we talk about insurance, this health claims exchange is connecting the payer to the healthcare provider.
Okay.
So a hospital who is providing the treatment is connected to the insurance through this. So all the data is in a standardized format as per the IRDA regulations and as per whatever is the governmental regulations. We will have all those things so that there is in our journey of cashless for all, which the government which is a very big thing. Now, if that is happening, how will we standardize? Because today the problem is every insurance company wants a paper in a different format.
Okay.
Which is now, and the hospital is creating a different format. Now, how do we ask all of them to speak the same language?
Same language.
At least we can speak the same digital language, if not the same language. So we need to have the digital information being transferred. That's why the healthcare exchange, health claims exchange, is one of the most promising and immediately helpful thing. And the next is health information exchange consent. So this particular HIECM is the third gateway into the ABDM, and that is actually connecting our personal health records with the HMIMS. So there is something called as personal health record. So suppose a woman is pregnant. Imagine the journey for a doctor. A woman gets pregnant. And when she is pregnant, the baby is being given all the nurturing by the mother. But there is something called as epigenetics, where the genetic information which is passed on from the parents to the baby will lead to their physical transformation. But in that journey, the environment and the factors which will interfere can change the outcome.
Correct.
So a baby, whether the baby's birth weight will be low or appropriate, is decided in the intrauterine journey.
Okay.
And not at that time, that intrauterine journey, whatever wrong, suppose a person
Somebody
with an
smoker,
infection,
smoker,
or a smoker, or somebody is exposed to alcohol,
drink,
or chemical exposure,
exposure.
they are going to affect the baby. Now, this baby's life is not just affected here, but this is called as fetal origin of adult onset diseases. These children who have been exposed to insults in the intrauterine journey will have higher chances of heart disease, higher chances of diabetes, higher chances of blood pressure at an older age. Not just that their incidence is higher, but their probability of landing up with these episodes, whether they will land up in their 50s and 60s or 30s and 40s, is programmed here. So I always say, at this moment in time, when the baby is inside the mother's womb, they are not just getting manufactured by the mother, but they are also getting programmed by the mother. Now, all the information during antenatal, and then the delivery early 5 years of life, and then the vaccination and the immunization records, all these records may be of value in their old age. So,
and nobody has a record.
Yes.
Nobody
so
has
how can we create a longitudinal health record? We are only focusing on the horizontal record. Right now, my blood pressure is this. Right now, I have this problem. But if you look at the logic, if we want to create a strategy for a healthy India, healthy nation, and Viksit Bharat, we need to take care of our human capital. That is the healthcare of our people and healthcare of our personnel. And if we do not pay attention to this journey of health right from beginning till the end, and if we do not have the complete overview, we will not be able to serve them better. So if we want to do this whole ecosystem of using a public infrastructure in the digital space, which you asked about, digital public infrastructure, especially when it comes to the health sector, I think it's going to create a transformation in the way India reaches in the coming decades, and we reach out to become a developed nation.
That's something great. I mean, you've really given good insight about your mission. I'm sure in a small time of 10-20 minutes, it's not possible to cover everything, but we'll have some more episodes. But what I learned also, a message to pregnant is never smoke, never drink, because not only it affects you, but even your child who is in the womb for many, many years, as long as he is alive.
Only healthy mothers bring in healthy children, and healthy children make the nation healthy.
So that's the message that probably will close with this message. And thank you very much for coming on the Arogyam Katta.
Thank you very much.
Thank you. Is UHI part of National Digital Health Mission?
Yes, UHI, the Unified Health Interface, is actually part of the larger digital public infrastructure which is coming under National Health Authority.
Will every citizen get unique health ID?
Abha is the Ayushman Bharat health account, which every individual have a unique number, just like a PAN and Aadhaar number, which will have connection to all your health records.
Can UHI be used on mobile phones?
UHI accessibility will be there on every possible electronic modalities. So it will be a great thing to even have those UHI access and numbers, not just on mobile phone as an internet connected mobile phone, but also SMS based approach as we have in UHI.
Will UHI work with existing health apps?
So UHI is an interface. So all the existing health apps and health lockers and hospital management information system are going to have the APIs which are connected to the UHI. So whatever is the existing system will have some connection which helps the transfer of information from here to here.
Does UHI require internet access?
So for transforming and translating the data, it can happen at the local geographical level. But if we want to have an exchange and data transfer, we will need accessibility and internet connection.
Can patients see their medical records through UHI?
So it all depends on the user interface being used by the patient. So all those data and the records which they have to load them on a particular user interface which will have all the facilities as per their choices, and that information will be passed to the UHI. So UHI is not storing any information. The information is stored by your own user interface.
Will UHI help in booking doctor's appointment?
Yes, that's one of the greatest things. Not just booking the appointment, identifying the doctor in your geographical area, even finding whether doctor is authentic or not. All that information can be accessed and ensured through the use of a UHI.
Is UHI free for patients to use?
So UHI is basically a interface that the government is providing free of cost to all the players, subject to their validation and their acceptability as a process of registration. And if they fulfill the criteria, then it will be free for them.
Can UHI be used in government hospitals?
So right now, the biggest implementation is happening. So the Pradhan Mantri Arogya Yojana, which is one of the biggest public health uh, system, created the largest number of beneficiaries and the largest amount of financial aid going in, is actually going to be using this whole interface. But in due course of time, we have to understand that the whole ecosystem is not, it's like not just the government bank or the nationalized bank, but even the private banks can use the UPI.
Will private hospitals also be a part of UHI?
Well, I answered that.
Is UHI already being implemented, or is
crores of beneficiaries have been using the facilities created by the ABDM and the various different interfaces. So the three major interfaces which are being used, whether it is UHI or even the health claims exchange, it has already started to happen.
Can UHI help during the medical emergencies?
The best part about having your data at a click of a button is that sometimes when an individual is not able to give the whole history of all those nitty-gritties themselves, or the family members are not very much aware, even the simple access of their Aadhaar number will help to know so many things which you would have otherwise never come to know because of purely the piecemeal information by the family members or the total dependence on the individual's memory.
Which may not be correct too.
Which may also not be correct.
Can UHI support telemedicine?
Yes, so one of the biggest thing about telemedicine is transformation and the accessibility and interoperability. So by use of an interface, the best of the doctors and the best of the second opinions can actually be taken because all the data can be smoothly and easily transferred from one place.
Can UHI help in tracking vaccination?
Which is the biggest proof that CoWIN app has done. And I think if that whole system is integrated and it is being done, our national immunization program and the immunization vaccination details are being actually now utilized and will be uploaded into the system. So imagine I will exactly know at a click of a button at what age, at what time my vaccine were given to me. And I will carry that information. And when I'm being admitted or if I'm, say, for example, a student traveling for an institute and they're asking for vaccination details, everything will be at a click of a button.
Last out of syllabus question. Everybody is under impression that vaccination is only taken when we are young or when we are children. I believe now adult vaccination is also coming in. What's your take on that?
See, I'm a gynecologist and an obstetrician. I'm extremely pro vaccines. So there is a concept called as vaccine hesitancy, and there is a concept called as life cycle immunization. Meaning that now we don't say that vaccination are only for the newborn. We give vaccination even before the baby is born, that is in the antenatal period, to protect the mother, to give her good health so that the baby has good health, and give the vaccines to the mother so that the baby will be protected in the first few months of life. Then comes the childhood immunization, then the adolescent immunization, then the reproductive age immunization. So, for example, there are some vaccines which have to be given in the reproductive age. So, for example, a woman, if she not immunized for rubella or chickenpox or typhoid or influenza, it can affect the woman's health during her pregnancy journey. And then comes the geriatric population, the senior population. So the vaccines for the pneumococcal vaccine, for meningococcal vaccine, influenza vaccine, all these things will help the senior citizens. It will be a great thing. Sometimes the senior citizens say, no, we don't have, we didn't have typhoid vaccine when we were young. So who stopped you to take it now? Because the senior citizens are the ones who are eating more outside than the younger ones nowadays. So protection has to be for everyone. It has to be universal, and it is a collective effort for the whole population. Please stay safe, stay healthy, take your vaccine.
Thank you very much.
If you like the video, please subscribe to our YouTube channel, Arogyam Katta, where we bring you insightful interviews with doctors from various specialties. Stay tuned for expert advice and valuable health information.